Anita Anand is Canada's Procurement Minister, and for transparency's sake, I do want to say that my husband is a civil servant in the Department of Public Services and Procurement, though he's not involved in procuring vaccines. We reached the minister in Oakville. Minister Anand, I want to start with the news today about the Pfizer-BioNTech vaccine. We're talking about hundreds of thousands of doses that are going to be delayed over a period of about a month. Right now in Ontario alone, we're seeing upwards of 20 people a day dying in long-term care recently. How serious a blow is it in your estimation that we're dealing with this delay?
Well, I think we have to remember that there is a public health response to the COVID-19 crisis. And one part of that response includes vaccinations. But as Dr. Tam and Dr. New said today, we still need to follow public health guidelines, social distance, wearing of masks, and staying at home as much as possible. So there's a multi-pronged approach. Vaccinations are one important part of that, and we are continuing to procure vaccines. The announcement today relating to the disruption from Pfizer is not going to change the overall numbers that we will receive in Q1. We will ramp up significantly in Q2, having millions and millions of doses coming into this country. And we anticipate getting a total of 20 million doses in Q2 from approved vaccine suppliers, Moderna and Pfizer alone. And so really, Catherine, there is a step-by-step approach on the table here, and we are following that approach.
I take your point about other public health measures, but I still wonder what you would say to a healthcare worker in this country or someone in long-term care who has been waiting for an appointment and now understands that they're going to have to wait a bit longer to get their vaccine.
Well, Catherine, my own father, who just turned 90, is in the very same boat. And I feel very disappointed with the news relating to Pfizer today. By the same token, our procurement strategy was one based on diversification. We knew that there may be problems in the supply chain, and that is why we procured over 400 million doses of vaccines from 7 different suppliers, the largest portfolio in the world, the largest number of doses per capita in the world. We need to plan for the long term, is what we told ourselves, and we have done that, and we are able to withstand this blow that we are hearing about today in order to stay on track with our vaccine schedule to make sure that all Canadians have access to a vaccine prior to the end of September 2021.
Did you try to do anything to stop this particular delay? Did you make an effort to negotiate with Pfizer to ensure that Canada wasn't directly affected?
We are negotiating every day with Pfizer, and indeed in my telephone conversation with them, I did raise what other measures we could take. And the reality is that this isn't a question of price. This is a question of their facility and their desire as a corporation to ramp up significantly over the next quarters. And as a result, across the board, for any country that is being serviced out of the European facility, we are all having to withstand a reduction in the number of doses that we were previously allocated.
What about getting it from a U.S. facility instead?
The contract that we have with Pfizer specifically states that we will be receiving doses from the European facility. The items and doses that are being produced in the United States, I believe, are solely for the United States.
Okay, so essentially, tough luck is what it sounds like. I wonder, though, when it comes to trying to make up for these delayed doses, do you have a guarantee that they will be made up for by the end of March?
Well, as you can see, today is the lesson that supply chains are unstable at the current time. Every country in the world wants the same thing from a handful of suppliers. And as a result, the word guarantee probably isn't appropriate, but we did have an assurance from Pfizer that we are on track to receive the full-fledged number of doses from them by the end of the quarter. And then again, we'll be ramping up with millions and millions of doses in this country over Q2 and Q3 so that we can reach our goal of having enough vaccines to vaccinate the entire Canadian population and more prior to the end of September 2021.
We will get to September a little bit later, but right now I want to ask you about other vaccines. As we see this short-term diminishment in what we were expecting, is there any chance, for instance, that Health Canada could approve another vaccine this month? Is that on the table at all right now in terms of the information that you're getting?
Well, Catherine, my experience as a law professor prior to coming into politics made it clear to me that the work of government is separate from the work of regulatory bodies. And we must let them do their work and base their decisions on the science and the information that they have before them. And once there is an approval of additional vaccines, we will make sure the vaccines come into this country pursuant to the agreements that we have with companies such as AstraZeneca and Johnson & Johnson.
And yet the past has shown us that, for instance, I remember Dr. Sharma saying with both Moderna and Pfizer, we might be able to offer up an approval in a 7 days or 10 days time. We know those were rough timelines. They were contingent on work being done. But surely you are being given some kind of timeline. And so I'll ask again, another vaccine this month. Do you know if that is on the table at all from Health Canada's perspective?
I do not know specifically anything about approvals that are forthcoming or in the near future. But what I do know, Catherine, is that my goal as the Procurement Minister is to make sure that as soon as possible after regulatory approval, we do have doses of the approved vaccine in this country. And that's what my department and I work on every single day, the acceleration of vaccines so that we can get them into the arms of Canadians as soon as possible.
When we look big picture, when we look around the world right now, Canada is 10th or by some measures 11th in the world in terms of per capita vaccination, middle of the road when it comes to G7. Is that good enough in your estimate?
My goal is to make sure that we place Canada in the best stead possible, given the many limiting factors that we are facing. And I will say that we were one of the first countries to sign with Moderna and Pfizer, one of the first countries to have inoculations beginning, one of the first countries to make sure that in every jurisdiction in the country, people are getting inoculated. And
but so we're 10th right now, Minister, right? I appreciate all the firsts, but we're 10th globally. Is that good enough?
Listen, we are making sure that we have vaccines for every single Canadian. That's our role as a federal government. We will be providing those vaccines free of charge, and we are also providing all the supplies necessary to the provinces and territories. So in other words, we're taking a comprehensive across-the-board approach as the federal government to make sure that the provinces and territories are supported in the vaccine campaigns. And that includes making sure we have vaccines in this country on a rolling basis, beginning in Q1, of course, and carrying on through Q2 and Q3. And we, as I said, are going to see significant numbers, millions and millions of vaccines rolling into this country in Q2 and Q3. And we will make sure that all Canadians who wish to have access to a vaccine will indeed have access prior to the end of September.
What percentage of Canadians are you expecting that to be?
Well, that's a great question. Again, it is hard to say. We do see on our side a lot of demand for the vaccine. And to me, that's a very good thing because we want to make sure that the science is out there and able to be followed by the Canadian population. But in terms of an actual percentage, I believe it's fairly high, but I don't have a precise number.
Okay. The last thing I want to ask you, given that you are the person who is, I know you work with a large team, but you're the one actually trying to procure these vaccine doses. You know that other less wealthy countries are also desperate for vaccine. Canada recently said no to a WHO request to donate some vaccine now. As the person who is trying feverishly, I imagine, to get as many doses as possible, when would you feel ready to see Canada start giving some of these doses away?
Well, I want to be clear that notwithstanding our very large portfolio of vaccines, the largest portfolio in the world, we have also at the same time committed to the COVAX facility run out of WHO and the Gavi Alliance. We have the priority, of course, to make sure that all Canadians have access to a vaccine. And at that point, once that occurs, we would like to then begin sharing with the developing country. I work closely with Minister Gould on this initiative. She and I are very much aligned with the Prime Minister in terms of our goal to make sure that we are sharing vaccines with less developed countries to make sure that everyone has access to safe and effective vaccines. To the extent that Canada can approve and participate in that, we will definitely do so.
But I think I heard you say there it won't be until every Canadian has had an opportunity to get it.
Well, that is, again, a priority of our department to make sure we vaccines for Canadians here. And that's why also that I'm working with Minister Gould to make sure that the alliances that she is part of and indeed leading are part of our strategy going forward as a federal government and on behalf of Canadians.
But I want to be clear about what you are. I appreciate that you're working with Minister Gould, but what I heard you say is other countries are going to have to wait until all Canadians are vaccinated, which means organizations like the WHO, based on the timeline you've been giving, are going to have to wait until September.
Catherine, it's very much a step-by-step approach here. What the announcement from Pfizer showed us today is that supply chains are volatile and that we all need to take a step back and understand that our deliveries are on a week-to-week basis and we're providing as much information to the Canadian public as we have. Indeed, it's less than 24 hours that I had a conversation with Pfizer about the reduction in deliveries that they'll be making over the next weeks. But all that to say that the intention certainly is that we will be sharing vaccines with the underdeveloped countries of the world, and we will make sure that we are working hand in hand with Gavi, with the WHO in terms of making sure that occurs.
Okay, we're going to have to leave it there. Thank you for your time today, Minister.
Thank you so much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.